Good evening, Mr. Eder Hernandez. How are you, sir?
Doing good. Good evening.
So I bet you've been a busy guy the last I don't know, last few months, I guess, huh?
Yeah, it's busy now. I mean, we have a huge surge. This is welcoming the fourth wave of COVID, but this is
So
the Delta wave. This is the fourth wave that we've experienced as a nation.
the fourth wave, and then does that include this lambda wave we're listening to, or is that something even totally different?
That's different. Right now, they're just focusing on Delta. Delta is pretty much up to 90% of all COVID infections in the U.S. are the Delta variant, which is the one we're highly concerned about. And there's a couple reasons why. We can discuss it when the viewers come on or when
Mhm.
the questions come.
Yeah, it's been the one big question of the night is going to be now that school's going back. What is your particular opinion? Is it safe for kids to go back to school? Should they be masked all day? Is there a problem with that, or what should be? How should masks for young people, going back to school, be handled? And just in your opinion, I'm not saying you're. We're not going to hold you to that, but just your personal opinion.
Yeah, and I think we have to look at what TEA is doing. We're familiar with the TEA guidelines. They're not going to do contact tracing, and that's an issue because when your
Yeah,
child is exposed at school, and you have a confirmed exposure, when that child, if the child is not notified, the parents are not notified, that child can come back, and while the virus is incubating in his body, you'll find out, 7 to 10 days later, child turns positive, and at
yeah,
this point, the person, now everyone at the home is exposed, and becomes a problem. So I mean, it's going to be. I can tell you that we're going to have a major surge by the end of the month here in August. It's going to be like something we've never seen before. This is because this virus produces 1,000 times more viral load, according to the experts. 1,000 times more viral load copies when you compare it to the original Wuhan China strain. So the more viruses we have, the more chances you have to spread it. So if to put it in perspective, is in the original strain from Wuhan China, it was if one person infected two, in this Delta strain, one person will infect four. It's twice as contagious.
holy cow! Well, that can't be good. And that brings up another question right from there. Um, so right now you've got Pfizer, you got Moderna, and you've got Johnson and Johnson. Is that correct?
Yeah, there's a Novavax as well. There's another vaccine, and then you got one that it's not approved in the U.S., but they're using it in Mexico. It's called Zinavac, and then that's made in China. I think
Made in China.
you want to stay away from that one, right?
Holy cow! So, in your opinion, between those, let's say the main three, the most popular three, is there one more effective than the other? Do we even know that yet? I know there was a report that came out. I think it was just today that saying that the I think Moderna was a little more effective than the Pfizer one was.
Sure. So I'll have a disclosure. I have done some research with Moderna, uh, and I was actually one of the original 15,000 human subjects with the original Moderna vaccination. So I got my vaccination through a clinical trial back in September of 2020. So it's almost been a year, and I'm very happy to be part of the study. I'm very happy that I'm still being monitored as a subject. And the reality is that because of the vaccination is why I've been able to deliver so much care to thousands of COVID positive patients. And so, I'm very grateful for the vaccination, because at this point, um, it's a serious matter. We're pretty much playing with fire and this virus on a daily basis. So I personally like Moderna if you look at the structure of the vaccine, Moderna has 3 times the mRNA
Hmm.
component of the spike protein genetic code than Pfizer. And some of the people, or some of the experts, are thinking that this is the reason why we have more breakout infections with vaccinated Pfizer patients. So I really enjoy Moderna. I think it's very safe. Um, if you've ever had the vaccination, there's a 2-dose series. It's a 100 microgram injection, and it's very, very important that we, notify, really look at the difference, right? And so they both were effective in preventing, um, you know, hospitalizations and death. And so this is really what the vaccine is focused on. It's, some people can get a breakthrough infection, and that's okay. These people that have breakthrough infections have less complications, have, they're almost little to no chance of getting hospitalized or having any or risk for death. And that's the reason why vaccines are so important.
Good question here. Is the vaccine that that you talked about it from Mexico, is that being used on children over there as far as you know?
I don't know the logistics or the standards. I just know that there's a Xenovac vaccine used in Mexico. There's AstraZeneca as well as over there. But here, I think the FDA approved Pfizer, Moderna, and Johnson and Johnson. I was a sub-investigator for Johnson and Johnson as well. They have a 2-dose series. They're trying to improve their effectiveness, and so I was the one leading that study as a sub-investigator in here in Brownsville. So that was exciting to be part of that. And
Mhm.
just to advance science, I'm a PA by trade. I'm nationally board certified. I have a multi-state license in different states. I also have a doctorate in medical science, and I'm a medical scientist, and that's a separate. It's very hard to find a clinician and then someone that's a medical scientist. So I value science, and I focus on patient care, but I also focus on how do we advance science to bring more solutions to our community.
Yeah, very, very good point. So back to that question again, is there any, as far as you, I guess in your opinion or what you've seen, is there one of those that's more effective than the other? I know you said for yourself, you like Moderna, is that correct?
I like Moderna because, if we look at it from a practicality standpoint, you're getting 3 times more bang for the buck. You're getting 3 times more mRNA, and that in technically parallel should produce 3 times more of the antibodies than when you have Pfizer. So, and that's something that just I'm mentioning myself, just thinking kind of like outside the box without really looking at the logistics or the actual evidence. But you're getting 3 times the amount of 100 micrograms of mRNA comparable to 30. You should produce more of a robust protection. These antibodies
Yeah.
specific to the subunit of S for the virus protein, and the reality is, um, I feel it's very safe. The vaccinations are very safe, and it's one of those things that the vaccine is going to save countless lives. And also, if we don't have strict vaccination guidelines, it's also going to affect us specifically with children. Unfortunately, when we do clinical trials, there's phase 1, phase 2, and phase 3 clinical trials. And as of right now, only Pfizer has turned in their information and got it approved by FDA to now approve children between the ages 12 and 17.
Yes.
Moderna hasn't put that in, but Moderna is looking at a vaccination for the variants. Look at African strain, UK strain, Delta. They're looking at these already because they know that they've been problematic for other populations as well across the world, and they're testing the vaccination on the effectiveness in children already. So we expect that to come by the end of the year if possible.
Excellent. Now, another question here is there a test kit for the Delta variant at the moment? Is there, how can, I heard that you can't tell from the same is it a PCR testing?
Well, we'll go back to what the tests are. So I think that's important. There's a rapid antibody test that tells you if you ever had COVID in the present or COVID in the past. Okay, so that's one type of test, and that is not an effective way of measuring anything, but either you had the vaccination or you've been infected with COVID. And the second test we can describe is a rapid antigen test. These tests are very effective in picking up when someone has active virus in their nose, in their nasal cavity, and it's about 95% effective. And those are rapid screening tests. So if you're positive in a rapid screening test, it's looking for the viral protein, the actual protein from the SARS-CoV-2. So it's very specific. Okay. And then when I get a positive rapid test, I go ahead and take a second nasal swab, and take that swab and send it to a CLIA certified lab that can type it and put it through a process called reverse transcriptase polymerase chain reaction, which is a long name for RT-PCR. So you take that genetic sequence and you run it through a thermal cycler, Thermo Fisher, all these big brands that focus on PCR, and you're able to amplify the genetic sequence, and then you can map it and say this is a guaranteed sample that has SARS-CoV-2, COVID-19 genetic material. And so that's the most sensitive and most sensitive, most specific, yet it is still not 100%. Nothing in science is 100%.
Yeah. So that next question was, what is the rate of false positives, or how often is that happening?
So I'll go back to Norman's question. On the Delta, what happens is the CDC, and I was in discussions with James Castillo. Dr. James Castillo is the Cameron County Health Authority, and we text back and forth. I mean, I rely on experts. He's the public health expert at this point in Cameron County for COVID. And we were discussing several cases, discussing what to do next. I just got an email as we're speaking that Cameron County is opening up an infusion center for the monoclonal antibodies. So, as we're doing our live, that's how we're intertwined with the county and with furthering the care of these patients. Now we're going to have access to a regional infusion center. To take that back into perspective, in February, when Cameron County opened their first infusion center, I was the first outpatient infusion practitioner that ordered the first infusion for the monoclonal antibody outside of a hospital in Cameron County. I was the first person to order that. We've always been on the front line. We've always been on the cutting edge, and the reality is it. Now there's a huge need for monoclonal antibody infusions, which are FDA approved for the treatment of mild to moderate COVID-19 disease, and we'll get into that. On the Delta side, the county sends a specific level of samples to the state, and the state will take a surplus of those samples and sample them and get a genetic sequence, genomic genetic sequencing, which is very complicated to figure out what strain it is, because all it is, sir, is it's a mutation on an amino acid structure of a S protein amino acid subunit, and that's how they can type it. If it's alpha, beta, gamma, delta, and we can go through the whole Greek alphabet at this point, So that's how they sequence it, and then they say, once they take an average, they can tell you 90% of the infections in the United States are from the Delta variant and Alpha. So we have 10% of infections with Alpha and 90% with Delta.
I see. Now, what is your take on so we had a PA the other day on here. I don't know if you caught any of that show, Mr. Miguel Escobar. And he was talking about there are many false positives, and they say they just keep running cycles over and over and over again until they start to catch something. Is that really how that works?
I think I'm going to speak for the whole. I'm a local leader for local PAs, and I'm also I'm also the director of the Academy of Doctoral PAs of the United States. So I represent over 3,000 PAs with doctoral training, okay, which is not all of them. We have over 121,000 PAs in the United States, and out of those 121,000, there's about 2,500 of those PAs have doctoral training. My training is in healthcare law, leadership, and disaster management. So the reality is when we have someone from our field that goes on a public forum and gives false information in regards to vaccinations that could be detrimental to someone's health, that's, that is unfortunate, but the reality is that we applaud the Texas Academy of PAs for providing a statement today. And when I read that, I was very happy with them. They're obviously not supporting the claim of the local PA that you mentioned in regards to the claims of vaccinations being such a negative impact against disease. I'm glad that I stand with them. And so it's unfortunate that he feels a specific way and can't really focus on what the science says, because, I'm, at the end of the day, how many patients do we know that had polio? How many patients have you seen die from meningococcal disease? Meningitis kills you in 24 hours, yet we have a vaccination that everyone gets when they're 11 years old and then a booster at the age of 18 when these infections most arise. People die from meningitis, and it's very common, but because of the vaccination, these lives are saved. Human papillomavirus, women are dying from uterine cancer, cervical cancer, and we've detected the viruses that are oncogenic that cause cancers, and they made it into a vaccine called Gardasil, and it literally takes, I think it's 16 virus types that cause cancer. And so now we're eradicating cancer, cervical cancer, and it's polio. Polio, obviously, we have our MMR, varicella vaccines. Our influenza vaccine is different. That is such a wild type. It's one of those things that the scientists have to look at the circulating strains the year right before the year starts, so they can develop the actual formula of what's going to be produced for that year to combat the strains that are in circulation. So there's so much science that goes into it. And I personally can tell you, one time I was taking care of a family and they all had the flu. I saw them, it was like a mother with 6 kids. They all had the flu. And obviously there's antiviral medication that we can prescribe for that. And I prescribed the medication for the family. The mother was not a patient of mine. And then I got a hold of the kids for follow-up 2-3 days later. And the oldest kid, he was 16 at that time, and put his dad on the phone and said, "Hey, my mother passed away from flu. People still die from the flu. She was unvaccinated, and she died from the flu." So vaccines are effective and they work, and I highly recommend that anyone has any specific questions on vaccines. I'm not gonna say I'm an expert, but I've been doing this a long time, and I've given possibly over 50,000 vaccines in my lifetime. So I can tell you that vaccinations are an important part of humanity at this point.
So are boosters not yet? I know there's talk about it, but they have not been released yet, from what I understand. And even then, they're going to release those, I imagine, to those most at risk. Or do you know anything about the boosters at this point?
So I think, so Moderna is doing some studies on boosters with the variants, and they're looking at a booster with multivariants to be given 6 months after the second dose, because we now know that after 6 months from your second dose, the effectiveness of Moderna drops to about 93%. And so when you get that booster at half the amount of the mRNA at 50 micrograms, they're seeing that it's producing a robust immune response, like if you had that second dose at that same time. So the reality is boosters will come into play, and they're going to be needed. And I think the government right now is trying to figure out how do we get our population that's at most risk to get these boosters as soon as possible.
And is it inevitable that the boosters, everyone will need a booster, you think?
So it all comes down to, how do we want, we're an ecosystem, right? And so we become a host to these viruses, particles, fungi. So we're an ecosystem. And the reality is as a nation, we have to go into herd immunity. Okay, so how do you get to herd immunity? Well, you have to take, um, and I want to talk. Oh, I have a great comment here from Manny. Oh, okay, Manny Rivera. Yeah, let's
Yes,
keep
he
him
says
on.
thanks to Eder. He's doing great. Everything he's doing, God help me through him. Even when everything was against me, God used him in a huge way. God bless him and his team. Very nice.
And I can tell you, I have patients that come on here. I'm excited to see Manny, and I won't disclose, much information, but I can tell you that when I have a patient that trusts me and puts their life, in my hands, I try my best to do what I can. Specifically, someone is dealing with COVID. At the same time, I try even harder when I learn that someone loses a family member from COVID, and then you got that fear. Is it me? If I'm next, if my family member, my mother, my father, my brother, COVID took them, I'm next. Am I the next one? And
Mm-hmm.
so when I hear these stories, when I have friends that mother and father passed away from COVID, and so I told myself that anytime we get any of these individuals, we just try harder, and we help them out. So he's been blessed with the best care that we could probably give him.
That's excellent. Here's a question from Tina Miller. Can you explain how it is that RNA benefits the body? I think you might have touched on that already.
Yeah. So Tina, that there's no benefit. So just to put it into perspective, is the way they develop these vaccination. It is a new technology, and so what they did is that they took the genetic coding of the S protein and they mapped it out, and that mRNA encodes for a protein, and so now we use our cell machinery to tell that cell machinery, hey, there's this genetic code sequence, and I need you to produce this specific S protein. Your body then takes that into your ribosome, uh, takes that information, uh, produces an S protein that's shoot out from your cell, and then it creates an antibody mediated response where the antibodies really focus on this intruder and they make specific antibodies to that. So there's no that is how it works. Now, how does it benefit the body? Let me tell you this: when you have COVID-19, when your white blood cells engulf the virus and destroy the virus, and they engulf it, they really, really just engulf it and they tear up all the particles. All that viral mRNA is in your body. Would you want to have an mRNA for one S protein, or all the genetic material of a foreign virus, zoonotic in nature, that came from camels and bats? Or would you want to have one genetic code of an actual target on the on where the virus attaches to your human cells? So if you look at it from that perspective, there's a big benefit of having an mRNA that codes for a surface protein than having all the virus genetic material in your body.
I actually think I understand that. You put that very well. So, and this is a good question right here. If somebody's got a Pfizer vaccine, do they need the Pfizer booster, or can I get any booster? Is it mix and match, or?
There was some information on CDC in regards to this. It did happen sometimes. Obviously, they're stating that you got Pfizer, finish up with Pfizer, but at this point, people can pick and choose what they want on the booster. My recommendation is that you go to your primary care doctor, your PA, your advanced level provider, and you have them explain to you which is what does the science say, who is better than who, because at the end of the day, not everyone is created equal in these vaccines. Johnson and Johnson was a different vector. They use an adenovirus vector, which is a very common. They used the common code, took a genetic sequence from the common code, plugged in the DNA information for the S protein, and developed a vaccination. It turned out to be not as effective as the mRNA vaccines. You're looking at 67% for the Johnson and Johnson. Okay, and I've had patients. We've seen over 1,000 patients in our practices in 10 days.
Mm,
1,000 patients in 10 days. There's a huge
wow.
surge. I diagnosed COVID-19 today over 30 times. Okay, and they're all sick.
How
And
are they getting infected? Any idea?
Well, when we look at if we had 30 positive infections today, uh, 10 of them were vaccinated and 20 were unvaccinated, and that
Wow.
is what it is. So they're getting infected because people are getting lax. The first thing is we're not keeping our distance. People are getting lax. We're not wearing the mask. And now that this variant is 1,000 times more, produce more viral load, more contagious. If you're face to face with a person and you don't know their vaccination status, you could technically get COVID-19 as a breakthrough infection. And you, as a vaccinated person, that it is asymptomatic and go spread it to more people, and then we have a national crisis, a pandemic going on. So that's how they're getting it. There's unvaccinated people that are sick that are spreading to vaccinated individuals, which you know might be asymptomatic. They spread to more people, and the reality is right now CDC has retracted its being lax under masks. Their recommendation is using masks in indoor settings and in high transmission areas. So let's go back to the basics. What do we know about the virus? The
Yeah.
virus is highly contagious. It spreads. It's mutating. We're not in a safe zone right now. We have to as a group pivot, and that's a beauty about what I feel that I have as a PA. We're trained as generalists. Our background is military background, so we were born in the U.S. military. The military know that there was a shortage of physicians out there, and they developed an advanced level practitioner that didn't have to go to school as long, but was highly trained in medicine. And they produced this individual called the physician assistant, or the PA, which now they've changed the name to physician associate because they say there's nothing assistant about what you do. And
Mhm.
that name was changed a couple months ago by the American Academy of PAs. But as a practitioner, you have to stay up to date with all these changing science and moving forward with obviously what's going on in the pandemic. Now we have infusion therapy that's FDA authorized. Today, I ordered about 6 to 7 monoclonal antibody infusions on high risk patients. And these patients, by getting the infusion, we reduce their chance of getting hospitalized about 70%.
Oh wow.
Okay. So now I can diagnose you with COVID immediately on the spot, order your infusion therapy, send you over to Harlingen, get your infusion so we can neutralize the virus in your bloodstream, in your plasma, in your bloodstream. Once the virus is neutralized, then your body eats up the virus through its natural process, and it's over. Then we win. And so now we're able to do it faster. And I'm very proud to say that, and very, very proud to see, as we're discussing today, that I just got an email from Cameron County Health Authority that we are now opening up the infusion center. Uh, and I'm happy. I've been pushing it. I sent a message to our county judge. I sent a message to our mayor. I sent a message to the emergency management director, Cameron County. I sent a message to the health administrator here, and I said, we are doing mass testing, mass contact tracing, isolating patients, but we also need to do something for treatment. We really need the infusion to be in Cameron County, specifically in Brownsville. I applaud. There's a new RX pharmacy in Harlingen owned by Michael Muniz. He's a well-known pharmacist. He's got a PA, an amazing PA. Her name is Vanessa Covarrubias. She was a student of mine for a long time. I'm very proud of Vanessa for being the PA that's infusing all the positive cases in Harlingen. And she must be doing 30 or 40, 50 patients a day that are
Mm.
COVID positive, infusing them to save a life. So I give her a shout out. I'm happy that the state is reopening these centers, and I'm happy to flood them with patients. So most rewarding thing for us is bringing this solution to someone in need, someone that's sick from this virus. But because I keep hearing we're all going to get COVID-19, we're all going to get COVID-19. And that's not a goal for me. I don't want to get COVID-19. I don't
Yeah.
want you to get COVID-19. I want to protect you from getting COVID-19. And the way it starts is by vaccinations. Let's vaccine our people. Let's get our herd immunity up to 90%. We're at 45% now, according to CDC. Let's get up to 90%, and let's develop strategies how to mitigate the disease. How do we mitigate transmission? And especially now, the most risk is in children. Why is the most risk in children? Because the reality is children between the ages of 0 to 11 are at higher risk because there's no vaccination available for them that's approved or authorized by the FDA. So, if we can't protect the children, they might be asymptomatic, because if you look at the physiology of the virus, it affects the ACE enzymes and these ACE receptors, which is why men have a harder time with this virus, and people with prostate issues have bigger complications, usually men. And and that's why children are less affected by this coagulation cascade and blood clots because of the children, but they do transmit the virus. And you can have the child be a super spreader
And not even know it.
and not even know it.
So, in your experience, what percentage of your patients, I will call them patients, some people who come to see you, are children? Has that number increased?
Yeah, I mean, I diagnose COVID-19 positive on children every day. It's very common.
And you said before, let's get back to the basics. So let's go to the basics. One of the first steps, very, very basic one that's going around, obviously, is wear a mask and, put a mask on. The gentleman the other night, Mr. Escobar, was saying that masks, and I don't know how I feel about it yet. It's just a personal view. I'm not trying to push my views on anyone. But an honest question, he mentioned about, when you have a mask on and if you can breathe through it, it'll fog a mirror or a piece of glass right in front of you. And if that happens, well, then particles are coming through and a mask is useless at that point. It is really useless. What do you say to that?
Well, I mean, in part, the gentleman is correct. But I mean, I think if you're going to provide the layman with medical information, you just put it to the basics. Look, the mask is a barrier between you and the droplet and the particle. And so obviously there's different type of masks with different type of filtration systems. There's an N95 mask that prevents you from, particles, and up to 95% of particles,
Yeah,
right?
the
That's
N90.
that's an N95 mask,
Right.
right? And then there's a respirator that I use that's on my picture, when that the picture that you have.
Oh, yeah.
That's a P100 respirator. Okay, I go into COVID positive wings with my respirator, with a double mask, my PPE, my goggles, my face shield. I see positive patients every day. I've seen positive patients in the thousands, and I've never had COVID once. Why? Because first of all, I thank God for protecting me. Second of all, I'm very careful, very cautious, very conscious of touching my face, having my mask on, washing my hands, all these things that
Oh, I lost you there. I lost your audio. Stand by, guys. No, you might want to drop out and come back in, maybe, see if that'll clear up. Yeah.
let me go.
There we go. Well, we're gonna, yeah. He'll come back to it in a second. I will get to this one, Nelda. If other countries using vaccines on children under 11, I can see the wealthy taking trips to vaccine. Yeah, I can see that too. And I mean, when you got the money, you got the money. What can you do? So just know I'm not trying to influence you guys on whether or not you're going to wear a mask or not. My big thing is don't be a mask hole. If you want to wear one, wear your mask. If it makes you feel better, or if you do believe it protects you, by all means, wear it. But if you're not going to wear it, that's fine. Just don't shame those who are wearing it. Just be, there we go. Just be neutral with everybody. Don't be a mask hole. There we go. There we got you.
Sorry, I took.
That's all right.
There's patient. There are other practitioners calling me. We have patients. We had over 200 patients today. I mean, there's a huge surge, and It's just been crazy.
Well, this question real quick. Do you know if any other countries are vaccinating their children under 11 yet? I can imagine people that are wealthy might go out of the country just like they would for plastic surgery. Go to Mexico, go to Canada, go to the UK to get vaccinated for young people. Any word on that at all?
No, I don't think they're doing anyone under 11 at this point.
How many people, a percentage of people that you've seen are unvaccinated that you treat there? If you had to put a number on it, just,
Like an 80-20%.
80 being non-vaccinated.
Unvaccinated.
Wow.
Now, when you discuss the unvaccinated versus vaccinated, you can still be hospitalized with vaccinated, but if you compare the death rate of an unvaccinated person is 99% of deaths. The 99% of deaths are happening in the United States from the COVID vaccine, COVID Delta variant, comparable to vaccinated individuals, is 0.5 to 1%. So almost less than 1% of all deaths in the United States are people who have been vaccinated, which tells you that the vaccine is effective in preventing death and preventing hospitalizations. It doesn't mean you cannot get a breakthrough infection. Let's be real, people. We can get a breakthrough infections. We're seeing breakthrough infections. Why are we having breakthrough infections? It's very simple science, as Escobar mentioned. What's the science? 6 months down the road, your immunity drops. This Delta variant is 1,000 times more viral load, more virus copies. It's going to offset as viruses are climbing up. The antibodies can't catch up. They can't grab it on time. There's so many viruses, so you're going to become symptomatic and get the virus. The best thing that can come from that is to be grateful that you won't die from the damn COVID vaccine, COVID-19. You won't die from it. And that is the main goal. How do we preserve life?
So having you say that with those numbers that you just stated, the claim out there is that the COVID is 98 point, I don't know what, 6% survivable just alone without any treatment or doctors or anything at all. That goes against what you said right now. Now, and don't know if that number is accurate or not, but at one point that was stated that it was survivable at over 90%.
Well, at one point, we were thinking so many different things, but I can tell you that you can get COVID-19 and survive. The higher percentage of people, the higher 90%, 95%, 99% will survive. But we're not discussing the complications that come from post-COVID issues. Okay, I've seen a police officer had to retire because after beating COVID, he's unable to think straight. He's unable to calculate his thoughts. He's unable to function as a human being as he was in the past. Okay, this is called post-COVID-19 syndrome or long haul syndrome. I've seen people have complications from neurological complications to psychiatric complications to myocarditis to heart attacks to mini strokes. So yes, you will survive COVID, but there is a small percentage of population that have complications. So how do we manage COVID-19 in a positive patient? Well, I can't give you a medication that can kill the virus because we don't have any direct antivirals at this point. But we can work on and really help manage what the virus causes. The virus causes severe inflammation, specifically a cytokine storm with interleukin I6, IL6, IL11. These are inflammatory markers that completely destroy the host. They just, it just blows it out of a portion of the inflammation that occurs. And then it provides hypercoagulation, and people die from heart attacks, strokes, and blood clots. So the reality is the virus is deadly. It causes detrimental long-term effects. There's one of my physicians buddies that we've done work for a long time, was positive for COVID. He's more of an immune guru, so he just fought it off and did great. But guess what? He hasn't been able to smell for a whole year.
No.
His smell and taste never came back. And how do you, those are your five senses. How are we so capable of saying you're going to survive COVID, and now I can't taste or smell for the rest of my life? I mean, I don't think we want to have that problem.
Yeah, one of the claims from Mr. Doctor. Well, I don't know. You're a PA. He's a PA. You treat people. You heal people. Heal people. I'm just going to call you doctor, and I'm going to refer you to that doctor. I call my PA Dr. Betts. I call her doctor. And so if you guys don't like it, whoever doesn't like it, that's too bad. That's just what I'm going to say. So his claim was that they would test everything. He said at one point, even a glass of Coke, a can of Coke was tested, and it came out positive for. And like, what is there? Have you heard any of that kind of talk like that? Does that happen?
I mean, this gentleman, first of all, he's a PA, and he's got to refer himself as a PA, just like I do. The difference between me and him is that I have a doctorate, so I can actually call myself a doctor.
There you
I'm
go.
a doctor. Okay. I'm a doctor, but I'm not a physician. I'm a rare breed at this point, if you compare them. But, the fact that the gentleman was saying that PCR is not effective and you could test a cup of Coke and test positive, this is a joke. It's really, causing detrimental, people buy into the stuff and they believe it. And the reality is that people get hurt. You saw what happened with Donald Trump. He mentioned hydroxychloroquine. There's a couple that went and drank the hydroxychloroquine, from a fish tank, and they died. So our words are powerful. So, PCR is highly, highly the most sensitive and diagnostic test because you have to sequence material. How in his mind could the gentleman believe that the Coke will have a genetic material similar to the spike protein or the the mRNA or the RNA from the COVID virus? It's unbelievable. This gentleman will think about these things. It just doesn't make any sense.
Yeah. Here's a good question. Is it true? I've heard this a couple of weeks ago. People that are not vaccinated, that hospitals will not treat you if you're not vaccinated. Any truth to that anywhere at all?
Well, Hungry Hippo, the good thing is you're talking to someone that actually knows science and knows healthcare. There's a federal law called EMTALA. And if you show up to a hospital with an emergency and they don't treat you, they violated a federal law.
And that's whether you've got a virus or a gunshot wound or a stab or a broken arm, whatever.
Yeah, that is a big source of medical malpractice if you deny an emergency to anyone. You can describe an emergency as what Manny just described, but I can tell you that I've had a patient. So we have practices in the Valley. We have Brownsville, we have McAllen. We provide services throughout the Valley. I actually show up to Westaco for a project that I have there. So we're busy throughout the Valley. And I have a patient as we're speaking that I have at Edinburgh Children's Hospital with COVID-19 and pneumonia. Okay. So they had to go from one hospital to another hospital because one hospital told the patient that they were full, they have no more space to go somewhere else. So that is the gravity of the situation that we're having. The hospitals are full. And they don't have to, and it's against the rules that they won't take you. They don't have to ask your vaccination status in essence to let you in. That is against the rules.
Here's a good question. We are going to get back to this just a bit. Masks for children to wear. Single layer, double layer. I heard single layer. It's useless to wear that. What do you say on masks? You can get masks at the dollar store, and then you can get masks at Walmart and anywhere else for $10 to $15 for each mask. These are not very cheap, but what do you do for a child that he's got to wear this thing all day at school?
Let me bring you the mask that I send my kids to school with. Let me show you which one.
Gotcha. Everyone, thanks for tuning in with us on this Thursday evening. If you haven't done so yet, please give my page a like at Manny Behind the Mic on Facebook, Manny Behind the Mic, and give us a subscribe on YouTube, youtube.com/Manny Behind the Mic. Your support is greatly appreciated. Trying to get all the data, all different angles. A few days ago, we had Dr. Miguel Escobar, PA. He's a PA, and a lot of controversial stances he had. And so I do want to bring all sides and so you guys can make the best decisions for what's best for you and your family. Okay, what do we got here?
So this is a K95 for children, and this is what I send my kids to school with. And I got a 4-year-old and I got an 8-year-old, and this is what they're going to school with. I highly recommend that you get something in like a K95. You know, really protects particles. When you get the K95, it protects 95% of particles. You know, then you can get into fit testing and particles and looking at seals. But at this point, it's very, very simple that you wear a mask. It's a physical barrier. A surgical mask is not as good as a K95, and an N95 mask is not as good as a P100 respirator. So there's different type of masks for different type. But for the kids, if you possibly can get a very simple N95 mask, it is very easy to wear. You can purchase a UV light system on Amazon and put your mask in the UV light system, a little box that I have back there, and it purifies and sanitizes this by UVC lights.
Yeah.
And that's, guess what? My mask is clean. They could semi-reuse the mask, and then in 3 or 4 days later, after being using the UV light, getting rid of it and getting a new mask. Now, at the least case scenario, you would use a simple surgical mask.
How long does that take to sanitize with the UV light little system that you're talking about?
It's like a 3-minute cycle.
Just a 3 minute. Oh, so you do that every day virtually. As soon as they get home, poop.
I get home, all the masks go in the UVC light, they get sterilized, and they're ready to go for the next day.
And in case you didn't know, people, you can get that same UV light. What do you call it? A disinfectant. What do you call that?
UVC
light. For your cell phone, for your mobile phone. You put it in this little box, close it, and it will kill all the germs that are on your phone.
Yeah,
and that's good to do that also. Does that one for kids have the double elastic like these do for the adults, or is it just a single elastic?
No, it's a single. It's very comfortable for the kids, man. I love this. I mean, I get away sometimes using this myself, and it's very, very easy to use, very comfortable.
Oh, okay. Each year, okay.
Yeah, I mean,
because this thing is really tight.
Yeah.
You put this on, it really tight. It really hugs your face.
You have more of a medical grade. I actually have those in the practice for the staff.
Excellent. Also, another basic step: social distancing. Keep your distance. Stay away from Walmart, HEB, crowded flea market, things we have like that here. We're still not, according to the outbreak, it's still not safe to be in a crowd, right?
Oh yeah, of course. Keep distance.
And the 6 feet rule, I know at one point they shortened it at, I don't know where.
3 feet. They went to 3 feet, and then they said 6 feet.
And gloves for your hands. Is it better just wash your hands regularly than wearing the plastic gloves?
So wash your hands 20 seconds with a nice soap. If that's unavailable, then you need hand sanitizer with a 70% or above concentration to kill COVID-19 and other viruses and germs.
70% of alcohol, right, or above?
Yeah, 70%.
Yeah, if it's less than that, it's not going to be effective.
Yeah,
I remember that.
Correct.
And then what can somebody do? We're talking about immune system health. People can change their diet. What can they add to how can they improve their diet to maybe improve their immune system to try to fight this thing off naturally at first?
I mean, so most of our immune system sits in the gut. So if you got a leaky gut, you got gut problems, then you have immune system problems. So things like Activia yogurt, Yakult, that have these probiotics in there with bacteria that are part of our intestinal tract that help the immune system. Vitamin D levels are there's some studies that say that when your vitamin D level is low, which 9 out of 10 adults, their vitamin D level is under 30, which is low, and when you increase the level to a higher normal standard, there's less complications from COVID-19 and less death rate. So when you're diagnosed with COVID-19, in our practice, I'm giving you vitamin D 50,000 units once a week.
50,000 units.
Yeah.
And
Over the counters, 5,000 units. I'm giving you 50,000 units once a week.
And what about zinc? Is zinc in your system effective against this?
Yeah, zinc has a ionophore a way of kind of neutralizing the virus in the cytoplasm into replication. So vitamin D has a purpose. Zinc has a purpose. Okay, melatonin has a purpose actually in preventing cytokine storm. Aspirin has a purpose in COVID-19. There's so many purposes that you can kind of line, and that's why you need a good healthcare provider that can really, put this because every patient is different. It's not a cookie cutter type. That's what's called the art of medicine or the practice of medicine. You're always going to practice it. After 13 years of practice, we're still practicing an art, and so we're trying to be masters of our own craft, and we're learning as we go.
Yeah, and there's no two people alike. So what'll work for me won't work for you, or won't work for your neighbor next door. Everybody's got to get creative with how you treat, I imagine. Ms. Diana is asking, who are the main biggest financial supporters of your organization? I don't know what organization she's talking about. Where you work, is that your own practice?
So the organization, financial supporters, we're a private practice, so we're not supported by anyone or anything. We're supported by our good work in our name, the medical school. So I was part of the original, back when University of Texas Pan American was, before it was UTRGV. That I've been a PA since it was a UT Pan American. So I've worked with them before on many projects, and I precepted a lot of students. The chair of that program is a good friend of mine. They don't provide any financial support. We provide support to them by helping their students.
Right. Chuck Nelson. Hey, Chuck, how are you? Chuck said, like the other night, everything that he brought up, he's talking about Mr. Escobar. I could look up and see that there was counter evidence to his points. Yes, we just addressed a bunch of those tonight. Ben answering him. So are you saying that Miguel is not telling the truth, or is he? What's, just not to put you on the spot, but your thoughts on a lot of what he had to say? I don't know if you were able to catch a lot of what he had to say, but
well, the whole thing went on for an hour and a half, I think, and there was a lot of rambling going on, and it's real simple. The science and the numbers are there. Vaccinated people have little to no risk of dying from COVID-19. Unvaccinated are dying at high rates. The vaccine is safe, it's effective, and that's in the story. And so, I'm not going to dig into what the gentleman was saying.
Yeah, I get you.
Wow, look at this guy.
Marcus Anthony Silva, shout out to my mentor, Eder Hernandez, the DMSc PA-C, the COVID Crusher. COVID Crusher, I like that. It's got a nice ring to it. Let's see. So clearly boosters are going to be required every 6 months to 12 months if the efficacy of the vaccine declines over time.
So Eddie, thank you, Eddie, for making that comment. I think you're correct. I'm looking forward to getting my booster as soon as possible. I don't want to get COVID-19. I don't want to have any complications from COVID-19. I don't want to have inflammatory problems from COVID-19. And so, I think boosters are the key.
Yeah, the one thing he did mention, we did talk about diet and inflammation. And one thing he did mention was cut back on the red meat that you eat. It does swell, makes you swell internally, the parts that you don't need swelling.
Of course. So yeah, that is great comment. Turmeric as well. Turmeric has anti-inflammatory properties. Cinnamon works when your sugar is high. And so their calcium helps, vitamin D helps the immune system. the Akiva yogurts, staying in shape. One of the risk factors for COVID-19 mortality is just being obese.
Yeah.
I've seen patients die from COVID-19 because they were obese.
Yeah.
That tells it all.
So okay, real quick, and we'll try to wrap this up pretty soon. We're approaching an hour already. So somebody who's vaccinated doesn't mean they're not going to get COVID. They can still get COVID. So is the point of the vaccine the severity of what they feel?
Of course. So the point of the vaccine, there's three endpoints. The first endpoint is prevention of getting the disease. The second endpoint is risk of being hospitalized from the disease, and the third endpoint is going to be dying from the disease. So the vaccination, if you have a breakthrough infection, then you bypass the first endpoint, but the second and third endpoint, which is hospitalization and death, is really where the vaccine shows how effective it is against you being hospitalized or dying from COVID.
Yeah, that makes sense. Prevention, somebody mentioned in a previous comment just a minute ago, but we already talked about, well, we kind of touched on it. How can somebody, just real quick, besides losing some weight, improve their immune system? I mean, just with diet-wise, what kind of changes to their diet can they make to improve their immune system besides, popping vitamins or something like that?
I mean, I think we all need to eat healthy, man, and if we look at our ancestors in the Mediterranean diet, these people they don't die from heart attack, from stroke. They have Mediterranean diets in low fat, low salt, low red meat, a lot of fish, a lot of clean protein. And unfortunately, with the American lifestyle, we've got to wake up early. We've got to get the kids to school. We've got to get them the chicken nuggets prior to going to school, and then we get out and we're very busy. We just came back from Chick-fil-A. We had a fried sandwich. I mean, it's tough. It's tough.
So yes, people are saying, again, just to add a little more to the question I just had, those who don't want to get vaccinated are going, see, he was vaccinated and he still got sick, so that's no good. But that's not the point of it. The point of it is, yes, you can still, we just talked about this. Yes, you can still get infected. Just hopefully the severity of what you get is not going to be as bad as if you were not vaccinated.
And I like Diana, because she's asking these questions. And I think to put it in perspective for her and the audience is, imagine we have a racetrack and we have two horses. One horse is a vaccinated horse and the other horse is an unvaccinated horse. The vaccinated horse gets a head start to the finish line. Okay, the vaccinated horse gets to the finish line faster and can finish the race, but the unvaccinated horse can have trouble in the in-between and not make it to the end of the race. That is the key of the vaccination. It gives your immune system a head start because it's already developed the antibodies to figure out that this is an intruder, that this is a foreign substance, a foreign material that I've got to go and attach as a key lock mechanism and attach and neutralize by neutralizing antibodies. So you're getting a head start. So please understand that the vaccine gives you a head start to finish the fight, to be able to finish as many years as you can of your life. And if you're unvaccinated, you're taking a big risk. You can have a fracture while you're running. That horse can fall. There's so many things that can happen along the line. There's kids that are 9, 10 years old on ventilators. There's people that beat COVID, but they're not the same. They're disabled.
Dr. Eder knows exactly what's going on and how to attack it. Please, if you need help or have COVID, go to his clinic and get treated. It works, and he's got a great team. Very kind words from some of your fans here. Eddie, what peer-reviewed medical study can you point to that confirms a cloth mask or even a simple medical mask, not an N95, actually stopped or significantly reduces the spread of this or airborne virus? Do you have any data on that at all?
Sure. So as a medical scientist, I mean, I focus on numbers and data. I'm data-driven. So I'm going to provide Eddie with a link that gives you the filtrations of these masks and what's proven. I think that he's got some great, don't take my word for it. Look it up, research for yourself. But I'll bring those points over, and I'll share a message with them.
Yeah, if you want, you can send it to me, and I can post it in the comments later whenever you do have that. I'll make that available to everybody. Raul, hey, buddy, thank you so much. Thank you so much. Infusion therapy helped me and my wife a lot. Really recommend infusion therapy. What is involved in infusion therapy?
So when I diagnosed someone with COVID-19, and I'm I don't know how many patients Escobar has treated from COVID-19, but we've managed over 4,000 positive cases. So I think we know what we're talking about at this point, and not other things that he's seen in the hospital. I'm telling you, I consult positive patients face to face. I see them, I see the suffering, I see what they're going through, and it's not something you want to have. Now, an infusion therapy is an FDA authorized monoclonal antibody. So the government, through research, clinical research, has developed antibodies with company, specifically this company called Regeneron, which is what President Trump got at Walter Reed in Washington. When they infuse you with this antibody, it literally produces neutralizing antibodies that neutralize the virus. And as it caps onto the virus is unable to replicate and gives your immune a chance to eat the virus up before it causes havoc. Causes coagulation disorders, causes inflammation, which is what kills the host being the human being. So I infuse people on the same day they test positive if they're high risk. What makes you a high risk candidate for an infusion? Being overweight, being obese, having hypertension, diabetes, high blood pressure, having cardiac disease, neurological disease, and even being Latino or Black. I can check off a box and get you an infusion if you're Latino and Black, because the CDC did a study and they figured out that Latinos and Blacks had higher incidence of death compared to other populations. Why? Because there's a high incidence of diabetes and comorbid metabolic syndrome in these individuals, in these populations.
Excellent. Elizabeth says studies are just that, studies. Nothing is 100%. Just because a study said it did something doesn't make it true or true for everyone, animals or in utero. Studies hopefully eventually come out with results. I imagine if they're big enough of a study, you get some kind of benefit out of it. Is that the point of a study?
Yeah, I think Elizabeth might be confused. A study is a study, and it provides people with evidence-based medicine. And you take the best evidence that's out there, the best medical evidence, and you apply it into clinical practice. And that's what makes you a great clinician. We know it's not 100%.
Yeah. Betty Rubble, I work with young kids and some are special needs and won't wear a mask. How can we protect them when we go out to PE, music, lunch, library, with general students? Yeah, I mean, what can you do? I asked this question to someone yesterday, to a parent. I asked somebody, a fan of the show, and I said, I haven't asked you, what's your opinion on what if your child or a particular child, I mean, at some point they're going to get frustrated and just want to take it off, I imagine. I don't know.
The simple answer to that is you protect the child by you getting your vaccine.
Yep. That's the bottom line, isn't it?
It's a simple answer. You protect the child by getting the vaccination and protecting the child, because they're not able to be vaccinated yet.
So even though obviously you've been administrating the vaccines, but even though they're not, at least not publicly yet, approved by the FDA, unless they have happened in the last 24 hours, I know it's supposed to happen pretty soon. You still say these things you're better to have them than not have them.
It's very safe. Like the analogy I gave you, would you want to have all the genetic material of a COVID virus that is zoonotic in nature, that came from bats and camels, all right? And all this genetic material that come from the virus, or just one encode of a protein that helps you fight the virus? I mean, I'm going to stick with that one protein out of comparable to all this genetic material from a foreign RNA that is not of human origin.
Yeah. So here's another point about the mask. Diana, again, I had a mask therapist, a therapist wearing a mask, massaging me with a mask on her face, and I could still smell and feel her breath. So I don't think the masks do much in a way of protecting. And it seems to be Yeah, I mean, she has a point to one respect, right? If you can feel her breath or smell it,
Yeah.
there is.
So I had a vaccinated a patient tell me, now the patient's positive, and I told him, well, how'd you get infected? And the gentleman, the patient mentioned, I got infected because I was face to face without my mask with someone, and I could smell their breath. If you're face to face with someone smelling their breath, that tells me that you're not following the rules and you're taking a risk.
Yeah, it's not a guarantee you're not going to get sick. So
Yeah,
I mean, still, I mean, my thing, even when I'm in public, outdoors, and somebody sneezes or coughs, I'm walking away fast in a different direction because those particles can float for a little while, or they sneeze. I'm walking the opposite direction real fast. Even if I have a mask on, I'll still say, yeah, I don't want none of that. Nice listening to someone talking about vaccines instead of going to a Tractor Supply. Okay, real quick, ivermectin. I've got some. We know that it's available at Tractor Supply, feed stores for animals.
Well, who mentioned to go to the store?
Oh no, these are just viewers who mentioned, oh, I'm going to go to the Tractor Supply, and somebody said, yeah, they sell them over there. You can buy them. You feed them to your animals. There, it's is it a flea repellent or something like that, or flea and tick repellent? And so everyone, including the PA, Mr. Escobar, also said, yeah, don't do that. Don't go doing that. And somebody went today and got a package of them, and I was like, I don't know if I would do that. It's not. So the question before was, does that really work? One, and two, is that something you would prescribe? Are you prescribing that? Not that I'm trying to get 1,000 people to come to your knocking on your door tomorrow, but
let me tell you this, man. I think I prescribe more ivermectin than anyone out here. I'll tell you that much. Okay. And so if we have 10 minutes, because there's a big subject, and is there any way you can get on a web page so we can show the viewers?
Sure. Yeah, go to
this is the NIH talking. It's not me.
Okay, go to the private chat you see there. Put the link in there, and then I'll copy it from there.
Okay. Let me get it.
Or you can message me on Messenger, whatever, however you want to do it.
Let me get it. 1 second. This is from the NIH. And
okay.
We're going to read it together.
Gotcha. While he's doing that, ladies and gentlemen, thank you for hanging out with us today with Eder Hernandez, PA. He's got a practice here in Brownsville, and yet another medical professional, and getting all angles and all points of view on COVID, masking, social distancing. Why are people still getting infected? Please share this with everyone. I think some good information here. And I'm not here to push my feelings and thoughts on you. I've got my own thoughts on masking and the vaccine, but those are just mine. And like I said before, my thing is, he'll be back here in a second, is don't be a mask hole. And, if you're going to wear it, great, wear it. If you don't want to wear it, okay, then don't wear it. But if somebody asks you to put it on for whatever reason, just put it on, and don't ridicule those who do wear them. So don't be a mask hole goes both ways. You know what I mean? And I think that's important. I think a lot of people, especially with the compromised immune systems, are susceptible to COVID. Let's see. There, you're back with us here. Did you send me something? There we go.
Yeah, it's on Messenger.
All righty. Just give me a second, folks, and I'll pop this up here. All right, there.
So I want people to see when you're talking to a medical professional, a medical scientist, and a clinician with high amounts of experience, how we function. And I want you to see, I'm here to educate the public, not confuse them.
All right, Melissa. We've been vaccinated since April. We still wear a mask out in public. So the cute mask with the kittens on them won't work. Most people are not walking around with medical grade PPE. I mean, I know the prices have come down on these significantly since all this started a couple of years ago. So they shouldn't be that bad. It would pay to spend some money to get a decent mask and get a UV light disinfecting system. Hey, Mary Lou, but they stopped counting breakthrough cases. So how do we know? Did they stop counting breakthrough cases?
No, let me tell you how that works, guys. When I diagnose a COVID-19 case, it is for my medical record to know if you're vaccinated or not. But when I submit a county form to the Cameron County Health, it just says positive for COVID-19 via RT-PCR confirmation. It doesn't say if they're vaccinated or not. The numbers get counted as a COVID-19 case. So that is a joke. That doesn't exist. There's no way to sidetrack from that. That doesn't make any sense. That is a false information.
Interesting. All right, let's see. A couple more comments, and I'll pop up the page here. Exactly. Don't shame those who don't wear it. Yeah, I totally agree. My kids and I have been vaccinated, but my husband Barney hasn't and won't get vaccinated. He's got his own room because I do not want to get sick ever again like I did last year. Yeah, I mean, if that's what works for you. Any comments on the use of ivermectin?
Let's click on the link so we can read what it says.
Let me take this comment off for a second, and we left off with Jay. All righty. Okay, ivermectin.
So I think you got the special voice, Manny. If you can read this for me.
Starting here at this part here.
Yeah, read it, and then I'll read the proposed mechanism. But you can read. And this is, guys, this is from the National Institutes of Health, the NIH, the COVID-19 treatment guidelines. They actually have guidelines how to treat COVID-19. As a practitioner, everyone should be on these websites. And this is in regards to ivermectin and that information that people want to know.
All right, we're reading right here, right now. Ivermectin is a Food and Drug Administration, FDA, approved antiparasitic drug that are used to treat several neglected tropical diseases, including, I don't know how to pronounce this word.
Onchocerciasis,
helminthiasis, and scabies. It's also being evaluated for its potential to reduce the rate of malaria transmission by killing mosquitoes that feed on treated humans and livestock. For those indications, ivermectin has been widely used and is generally well tolerated. Ivermectin is not approved by the FDA for the treatment of any viral infection.
Okay. So here, so it's not approved by FDA, but there is a proposed mechanism of action and rationale for the use in patients with COVID-19. So this gets to the bottom line, nitty-gritty of why ivermectin has been so successful. It has been approved in Slovenia, in Europe, in Mexico, India, lit up the Delta virus with ivermectin and this completely obliterated and destroyed the Delta variant with ivermectin. I can guarantee you that. There's studies. They looked at when they initiated, the Ministry of Health in India initiated, and it obliterated the Delta virus, the Delta variant. So the proposed mechanism here, if we read, there are reports from in vitro studies that suggest that ivermectin acts by inhibiting the host importing alpha and beta 1 nuclear transport proteins. These proteins are a key part of intracellular transport of viruses that hijack to enhance infection by suppressing the host antiviral response. In addition, ivermectin docking may interfere with the attachment of the severe acute respiratory syndrome SARS-2 coronavirus spike protein to the human cell membrane. This is a very powerful statement. It's saying that there's information, in vitro studies that suggest that ivermectin prevents the importing alpha and beta nuclear transport proteins that provide this type of viral cycle, and it also stating that there is a physical docking interference. Okay, and it is amazing. Okay, ivermectin is thought to be a host-directed agent, and which may be the basis for its broad spectrum activity against viruses like dengue, Zika, HIV. Okay, all right. So despite this, there have been no clinical trials that have reported clinical benefit of ivermectin in patients with these viruses. Okay, so there is some. They're giving you the rationale, and then they go more to talk about more rationale as you scroll down. Okay, so I mean they're getting to the nitty gritty of this thing here, and then you can read it. At this point,
I'll send a link to everybody so they can copy it and view it.
and then go to the very end there. Go to
Okay.
the very end, the very bottom, the very bottom. It says there are clinical trials. Several clinical trials that are evaluating the use of ivermectin for the treatment of COVID-19 are currently underway or in development. The government understands that ivermectin is playing a key role. They're not able to endorse it at this time. It could be your vaccine theory. It could be big pharma involved. There's going to be so many things involved. But this is strictly coming from the NIH. And they have a website called the COVID-19 treatment guidelines.nih.gov. That .gov is from the government, okay?
Right.
So there is an indication and a rationale suggestion of why someone would prescribe ivermectin versus COVID-19. With that being said, that's one of our go-to drugs. The patient must understand that there is no cure for COVID-19. The best way to beat COVID-19 is getting in a vaccination. But if you test positive for COVID-19, we have FDA authorized therapies like the monoclonal antibodies, and then some of these off-label prescribing that can be done with medical science as a background to really help the patient fight off the disease and the inflammation and the coagulation problems. So all this nonsense, in regards to ivermectin, there's some rationale to the use, and I can tell you there's so many clinical trials, and that's what the NIH is saying. And I'm not even providing you the trials. I'm just providing you their statement.
Right. That is excellent.
That is powerful. That if the NIH didn't have a rationale, they would put there is no rationale to use ivermectin versus COVID-19. It's not. Don't use it now.
Right.
Patients that are going out and buying horse paste and buying this, that is a very veterinary grade. That is not a prescription strength. That could be detrimental to your health. Go to your licensed healthcare provider. Let them, if they feel that between you and the patient that this is beneficial for your health, in regards to COVID-19, let it be between you and them. But do not ever self-prescribe yourself or go buy any medication from Canada or Mexico, horse paste. That is putting yourself at risk and at danger. Yeah,
don't go to the feed store and buy the packs there. You can get $20 or whatever they cost, $20 or $40. Go to a physician. Now this is treatment. It's not preventative. Is that correct?
There's another website. I'm going to post it. They have prophylaxis, they have prevention, they have treatment, and so it's there's so many guidelines out there and protocols that can be followed.
So so it's been said that someone who had COVID previously is protected from it now because of antibodies. Is that correct?
No, I've seen patients get COVID twice.
Yeah, so that's not even 100%.
The immunity lasts 3 to 6 months. A patient had COVID in November 2020 and then again in March 2021.
Aha. Low zinc affects the loss of taste and smell. Curious if you supplement. Do you supplement with zinc? Do you prescribe zinc or tell them to take zinc also?
One of our prescriptions, Diana, when you're positive for COVID, I give you zinc. I give you vitamin D. Okay, I'm working on your immune system. I'm working on inflammation. I'm working at zinc, as zinc has some antivirals.
Excellent. Rapid tests were also touted early on, and they've been shown to be unreliable. Many false positives. Yes, we did talk about this earlier a little while ago. Shout out to my mentor, Eder, the COVID crusher again, Marcus. The best Mr. Escobar said the hospitals are not full and the news is making up stories. I was at the hospital a couple of days ago, and I gotta say, there was no mad scene. It was not full. I was here in Brownsville. Doesn't mean it's not going crazy, but from what I saw, then again, they were keeping the public out for the most part. If you had no business there, they were not letting you in.
Well, what they mean, Chuck, I think, thank you, Chuck, for mentioning that, and Manny, what they're really focused on, Dr. Jamil Mahdi is the chief of ICU in Harlingen. He's a good buddy of mine. He's very vocal. He's intensivist and a very brilliant gentleman. And, he's the chief of ICU. I'm not familiar with the amount of beds. I don't think it's many beds. I don't think it's more than 27, 30 beds ICU has. And when you're an ICU chief and your beds are being filled up by COVID-19 patients that are unvaccinated, you'd rather have this it freed up, because what about heart attacks? What about strokes? What about other ICU cases? So at the end of the day, it all comes down to ICU beds. How can you take care of a patient that's on a ventilator, that's needed a ventilator, if there's no rooms or space? That's the problem that we have. If we had a hospital with 1,000 ICU beds, this wouldn't be a problem.
Yeah.
Very simple math.
Yeah, there was a video going around. Somebody who said I don't know if he was an RN or a physician, but he said, we got all these ventilators here in the room. They're not being used. There is no, crazy hospital scene. But then again, he could be way out there somewhere where there's no population and nothing going on too. So
yeah,
you have to really think about where that's coming from. We did discuss ivermectin and the efficacy. We're seeing the term staffed capacity, whether it's true max capacity or staff capacity, depends on the facility. Why are they understaffed? And if that's the case, also varies.
Yeah.
Go ahead.
Yeah, what happens, Shonda, is that they're understaffed because there's big payment contracts for COVID in other parts of the state, in other parts of the country. And so the nurses and medical personnel flee to those locations because the pay is so good and they got to go and they're out of nurses. It's a very simple math.
Yeah. And is there any truth to the, we keep seeing news reports. I don't know how accurate they are. Some of them are shady. It's like just a photograph of a screenshot. That nurses are getting fired. The nurses, there's a group or as many that don't want to get vaccinated. Same with some doctors, I understand. But are they actually? Have you heard this going on? They're actually firing them because they don't want to get vaccinated.
I mean, I haven't heard of anything locally, but I think people here understand the importance of the vaccine. And if you're in healthcare, you have some duty to your patient. You don't want to infect your patient with COVID-19, and you don't want your patient to infect you. So do yourself a favor and get the vaccine.
Hello. Hey, Snoopy. How you doing? Good evening, Doctor. People blaming the surge on immigrants. Thought on that? Yeah. My opinion is some of them are going to be infected. Some are coming in, but this epidemic is not because of them. That's my opinion. Yes, some of them are coming in infected, but I don't think that's why our numbers are spiking that much. That's just my opinion, though. Do you have any experience with that at all?
Yeah, no, that's not the immigrants are not the case of this problem.
So I continue to do curbside at HEB. I go to Walmart once in a blue moon, stay away from everyone. I go to Sprouts as close to opening on Saturdays and Sundays and hardly, that's my thing. You know what? You want to be safe? Go into the store, do your business, come out. Don't hang around there and just come in and out and get out. Go back to your home. This is per my PA. Matt, you provide information about the UVC lights on your page. Yep, I will do that. Absolutely. Hospitals are full, and this is happening, I know for a fact, in Mississippi, Louisiana, Florida, and Texas is catching up. I don't know. Texas, they keep saying, Florida, they keep saying that the numbers are inaccurate. I know they keep saying, there's 20,000 or 28,000 for a given day. And it turned out that might have been like for a 3 or 4 day period, not just for one day, just because of how the reporting works. Do you think we're getting accurate reporting, at least here in Cameron County?
Yeah, I think the reports are, there's a backlog, there's catch up. Once you report cases, there's a cutoff time and they won't get those cases till the next day. And then I think they have to do the contact tracing and call the patient, advise them, and I mean there's a whole process. So it could be a lag time or one day to. Oh, at one point where it was up to a week when they had hundreds and hundreds of cases.
Yeah. See, I have a problem with the TEA in the Texas Educator Association not requiring contact tracing. So in other words, if a child is infected, they don't have to notify anybody. They don't have to tell the rest of the class or send a letter home to the parents. I mean, that's crazy.
Yeah.
I don't.
Give it till the end of the month, man. We're gonna search like we've never seen before.
Yeah, that's not good. What vitamins would you suggest to help keep us safe? Zinc, elderberry, vitamin C, etc. Vitamin D, you mentioned also. Yep. Yeah, that's pretty much the basics right there. What's safe? What are high doses of vitamin C that are safe for the body to? I know vitamin C is pretty safe, except for affecting your stomach maybe. But how high of a dose can safely can somebody take?
What I do for COVID and vitamin C, I give them high doses, 1 to 4 grams, which is high. But if you look at New York, there's a study done in New York that the ICU doctors were giving patients very high doses, mega doses of vitamin C, trying to save them from the hyperinflammation states, and it worked. So vitamin C does play a role in COVID-19 and the immune system. So my recommendation, anywhere from 500 milligrams to 1 gram daily for protection of the immune system.
Yeah. So pills can come in as big as 1,000. I've seen them.
Yeah.
So we're talking a big dose.
I like the emergency packet.
Yeah.
You get to go.
That stuff is good. It's real easy. Just pop it in your bottle of water or your half a bottle of water. Actually, it says, and then just chug it. It's real easy. It's not bad tasting either. Do plexiglass shields work? I imagine you're in favor of any kind of partition. I imagine. Yes. Yep. There you go. Thumbs up. Exactly. That's why vaccines should not be one size fits all. Yeah, I guess I would agree with that if that's possible. And not the same vaccine. I don't know. The Pfizer that worked on me, or I believe is working on me, may not work on you or her or anybody else. But that's up to the doctor to figure out what's best, I imagine.
Yeah, I think when they do the trials for the kids, it's going to be half the dose of the adult. There's a pediatric dose and an adult dose. So the adult dose is the full dose. Pediatric dose is going to be a reduced dose.
Yeah, just to play it safe. Makes so much sense. And I mean, the organization that he said he's a part of it direct. Oh, whatever you do direct. I mean, organizations that said he's a part of it directs. Yeah, I think we covered it.
Yeah, so I'm the director of the Academy of Doctoral PAs. And there's over 3,000 PAs with doctoral degrees. And we don't have any financial support from our organization. I'm just speaking as a leader that we vouch for vaccines and we vouch for the integrity of the health system. And whenever we have misinformation that can affect the public, I feel that I can speak as a leader in our field.
Very good. We'll get a few more of these and then we'll call it an evening. I got one last final question, which we'll wrap up with. For example, a dietitian told me that Coca-Cola is one of the main financial supports of the American Dietitians Group. Yeah, believe it or not, it's funny this comes up. I saw a documentary today that blew my mind. It's on Netflix. It's called What the Health. Has anybody seen this yet? You should check out What the Health. And they're talking about who sponsors, the AMA, the Diabetes Association, the American Cancer Society, who sponsors all these, and you will be shocked to know what goes on there. Check out, that's your homework for tonight, on Netflix. It's called What the Health. So check that out. Turmeric is great for inflammation. You want to add black pepper to activate it. Oh, really? Black pepper, really? I'm not a sickly person. Hey, Lynn. Healthy and never get the flu nor flu vaccine. Yeah, I've never gotten a flu vaccine either, ever in my life. And I haven't been, when I do get sick, I get real sick. When I got the Moderna, I had full on flu symptoms and got very sick twice. I still got COVID last year and this year. Should I still sign up to feel COVID flu sick every 6 months? Yeah, that's a tough one. Some people I don't know. Are just some people just more susceptible? Just
Yeah, I mean, I've had people with the vaccine get the virus, and I've had unvaccinated get the virus. I've had people that didn't never got the vaccine, got sick with the virus 6 months apart. Again, I mean, it's
Yeah.
I haven't. Thank God, I've never had the virus.
Well, that's good. Hope it stays that way. Um, yes, exactly, Diana. Let's see. How do we, if somebody wants to contact you or get a hold of you or message you or a question or anything, what's the best way for them to do that?
I think this is more of an educational. I'm not speaking in any type of give medical advice to anyone at this point. You want to consult, you could. I'll give you my information in my office, and I can speak to you as a professional and look at the whatever you want to ask. Because a lot of these things are going to be clinical, and that becomes a patient practitioner relationship at this point.
Yeah. Well said. So we're going to wrap up with this question, which is what's been the hot topic the last few days. And I know I mentioned it right at the very beginning. Let's see. So it's important to know the comorbidities of those alleged unvaccinated people getting sick or dying in order to put the numbers in context. That makes sense. Absolutely sense. So are you okay with kids going back to school face to face as normal, like nothing happened? Well, obviously they're wearing the masks and everything. Will you be sending your kids back to school?
Yeah, my kids started school already. They're wearing their mask. I think, as soon as the vaccines are available for kids, we should vaccinate that population, and also the adults should protect the children by wearing their masks and being vaccinated. At this point, the children are vulnerable, and it's unfortunate they have to be living in these situations. But the vaccine is the solution to a lot of these problems.
Yeah. So to those that think, oh, my kids are going to die, they're going to go get infected, they're going to die at school. You don't see that happening. They're going to get so sick and they're going to get infected. Everybody's going to get infected, and then we're going to have to shut the schools down again.
Yeah,
You're saying nobody, they're not, it could happen.
it could happen. It could happen that we could have a virtual, but we have Abbott. Abbott is he's not gonna. It's gonna be
Yeah.
tough. Abbott is not gonna budge. He's not gonna move.
Yeah. And I mean, just today it was announced a couple of school districts, including Brownsville, ISD, BISD, and I think it was it La Jolla? They said they're gonna fight this thing from Governor Abbott, and they're suing Governor Abbott in the state of Texas. So this thing's gonna get really ugly. There you have it, everyone. Thank you so much for joining us tonight. Hope you took a lot of notes, and hopefully a lot of your questions were answered. I will put up some links later to those UV disinfectant or the cleaners or whatever you want to call them, where you can disinfect your phone, and they got bigger ones. You can put more items in there, which is what he's talking about. Keep your masks clean, or change them or wash them all the time. Don't let your kid go to school with the same mask without being washed like for a whole week. That's so real quick. That's got to be another problem. I mean, the kid, somebody, not an adult, just not cleaning a mask and wearing it for a week or two without putting it in the wash. What bad can come from that?
Well, I mean, obviously you're harvesting bacteria or germs, and you got to replace the mask. They're not. I have a P100 respirator, which is on that picture of me that you have, and I just replaced the filters. But that mask is good for 5 years.
5 years.
5 years, but it's a special grade P100 mask. What you're wearing, the masks that you see, are disposable, so you need to dispose of them. Obviously, we need to conserve our PPE. So what I have is I have UVC lights that by technicality should destroy the microbes on those and then for practicality purposes, use it for a couple of days and get rid of it, or at least that they feel clean or cleaner.
And there you have it. Mr. Hernandez, thank you so much for joining us tonight. It's been very informative. We do appreciate your time. I know you're very busy, and you're probably going to get back on the phone or answer some emails and see whatever else is going on. We thank you for what you do, and we appreciate any knowledge that you can share with us. Everyone, it's been a very delightful evening, to say the least.
Yeah, no, we're here to help and to answer what the questions. And
Do you want to plug your practice or where you're at? If you feel free to do so if you want. If not, that's okay too.
Yeah. So we're at Valley Med Urgent Care up in here in Brownsville, Texas. We have a location in McAllen as well. Our phone number is 956-546-2000 and 956-518-7444. And you were pretty much local outpatient community experts in COVID-19 by default because that's all we see at this point. So we're here to help you. If you test positive, you have questions. If you need a test, we can give you a test. If you need a vaccine, we can get you a vaccine. If you need guidance, we can give you the guidance. And you need an infusion, I'm going to order your infusion. Whatever it takes to save a life, we'll get it done.
Excellent. Just exactly what you want to hear. Guys, make a phone call if you have to. If you want to consult with them, make an appointment and do that. Everyone, thank you for hanging out with us tonight. It's been very informative. If you have any other questions for him that you want to pass through me, I'll be glad to pass those along. Mr. Hernandez, I appreciate you tonight. And
Thank you.
Thank you for coming on.
All right, man. It was very pleasant. Have a good evening.